Good afternoon. So we're at the Robertson House event. I'm just keen for you to introduce yourselves and tell us a bit more about the day that you've had.
I'm Sue Sheffield and I am the Strategic Lead for DSPL, which is delivering special provision locally for the county.
My name is Rachel Kennedy. I'm SEND Quality Assurance Team Manager.
I'm Elizabeth Eldred. I'm Deputy Designated Clinical Officer in Hertfordshire.
And correct me if I'm wrong, Elizabeth, that means health for the majority of us.
Definitely means children, young people with any special education needs, disabilities, mental health difficulties within health services.
Thank you so much. And I'm keen to hear a bit about what you've been doing today, what you've been focusing on. So maybe, Sue, if you could give me a brief overview.
Well, we started off today by looking at what's working well, what's not working so well, and those issues which are more long term, which for the moment we can't actually address. And we went into some considerable detail about that within our individual groups, then came back to share. And there was a remarkable amount of overlap and agreement in an awful lot of areas.
So you had the chance to look at what's working well, what's not working well, and also some things that perhaps are more of a national agenda, perhaps.
Yes, definitely, yeah.
Excellent, thank you. And I think as a group of three, you chose an area that's not working so well currently to focus on. Could maybe, Elizabeth, could you tell me a bit more about that?
So we are looking at mediation and sort of constructive conversations we have nearly turned our topic into with families, and hoping to come up with an idea of or looking at solutions for how that could be better for all families at any stage of the process.
Thank you. And Rachel, could you just give me a little overview? You've done a co-production event before with us. Why is this way of working so valuable?
I think it's really helpful because it gives us an opportunity all as a group to really sort of sit and reflect and think about, as we said, the different bits that are working well, not so well, and things for the future. But I think it ensures that everyone has a voice in that, because we're working in groups and everyone's having an equal voice in terms of looking at sort of the different areas, and it allows everyone to come together from different partnerships, agencies, and parent care involvement, etc.
And maybe just one other question, if I may. Just wondering about bringing lived experience into our conversation. Are there people involved in the co-production that have lived experience?
Well, in the larger group that we've certainly got people with lived experience, because we've got parents who've actually been through the process. We've also got professionals who have been delivering the process, and we've got professionals who've been supporting the process and involved with it in that way. So there's a huge range of lived experience, actually.
Thank you. Thank you so much for your time today.